It's Mental Health Awareness Week, and a local homeless shelter is speaking out, saying state resources for the mentally ill are declining.
They say people suffering from mental illness end up on the streets, in homeless shelters, and even in jail. News 18's Kayla Sullivan takes a look at what resources they say are lacking and ways the community and local government can help. Kayla?
Yes, many of the people I spoke with today say resources for the mentally ill are severely lacking, particularly in long-term treatment. Lafayette Urban Ministry Executive Director Joe Micon says the problem began back in the 1960s when the state started defunding and closing down mental institutions. He said they left local communities responsible for the mentally ill without providing proper resources. Since then, Micon says resources for the mentally ill have steadily declined and will continue to decline unless people take action. The Lafayette Urban Ministry takes in some of the mentally ill, but there's more of a demand than they can handle, and he says what they need is treatment.
There was a time in our community and in communities across the country where the courts and law enforcement did a more assertive, more aggressive job of getting the mentally ill on the streets into local institutions.
But Micon says the problem is that there are no institutions in Tippecanoe County. There are treatment resources within the jail and local hospitals, but there are no long-term treatment facilities once they're released. He says it's going to take taxpayers to be willing to pay more and legislators to budget enough money to create long-term facilities for the mentally ill. Micon says the Lafayette Urban Ministry works every year at the State House, and this year they're working on legislation asking for more flexibility for law enforcement to help get the mentally ill off the streets and into long-term treatment. Kayla Sullivan, News 18.